Fenbendazole, a benzimidazole class antiparasitic drug, has been widely used in veterinary medicine for decades to treat intestinal parasites in animals. This drug has been a staple in the veterinary world, ensuring the health and well-being of countless pets and livestock by effectively eliminating a variety of parasitic infections. Recently, it has gained attention as a potential repurposed drug for cancer treatment, following anecdotal reports and preliminary research suggesting anti-cancer properties. This unexpected turn has sparked a wave of curiosity and hope among researchers and patients alike, eager to explore new avenues in the fight against cancer. This video delves into the history, mechanisms of action, and available clinical evidence, including case reports and emerging trials, exploring fenbendazole's role in oncology. By examining the journey of this drug from veterinary clinics to cancer research labs, we aim to uncover the potential it holds for future cancer therapies. Developed in the 1970s by Hoechst AG, now part of Sanofi, fenbendazole was initially designed as an anti-parasitic agent for animals. Its development marked a significant advancement in veterinary medicine, providing a reliable solution for managing parasitic infections in a variety of animal species. Its efficacy against a range of gastrointestinal parasites, including nematodes and tapeworms, made it a mainstay in veterinary medicine. Veterinarians have relied on fenbendazole for its broad-spectrum activity and safety profile, making it a trusted choice for routine parasite control. The drug's mechanism, which involves binding to B-tubulin to inhibit microtubule formation, inspired comparisons to certain chemotherapy agents like vinblastine. This similarity in action raised intriguing questions about its potential applications beyond parasitology. Interest in fenbendazole as an anti-cancer therapy began with anecdotal reports, most notably that of Joe Tippens, a stage 4 small cell lung cancer patient who claimed complete remission after supplementing his treatment with fenbendazole. His story, shared widely on social media and various online platforms, captured the attention of the medical community and the public. This case, widely publicized online, led to increased curiosity and experimental use of the drug by cancer patients, spurring further research into its potential mechanisms and effects. Patients, desperate for new treatment options, began exploring fenbendazole as a complementary therapy, often sharing their experiences and outcomes in online forums. Fenbendazole exhibits several mechanisms that may contribute to its anti-cancer effects. These mechanisms are multifaceted, targeting various aspects of cancer cell biology and offering a comprehensive approach to inhibiting tumor growth. Microtubule disruption. Like some chemotherapy drugs, fenbendazole binds to B-tubulin, inhibiting microtubule polymerization. This action disrupts the structural integrity of cancer cells, preventing them from dividing and proliferating. This disrupts the mitotic process in rapidly dividing cancer cells, leading to cell cycle arrest and apoptosis. By halting the division of cancer cells, fenbendazole effectively reduces tumor growth and promotes the death of malignant cells. Inhibition of glucose metabolism. Cancer cells rely heavily on glycolysis for energy production. This metabolic pathway is crucial for their rapid growth and survival, making it a prime target for anti-cancer therapies. Fenbendazole has been shown to interfere with this process, reducing ATP levels and starving cancer cells of the energy needed for survival. By disrupting their energy supply, fenbendazole weakens cancer cells, making them more susceptible to other treatments. Induction of apoptosis. Preclinical studies suggest that fenbendazole upregulates the tumor suppressor gene p53 while downregulating anti-apoptotic proteins such as BCL2, promoting programmed cell death in cancer cells. This dual action enhances the drug's ability to trigger apoptosis, a natural process that eliminates damaged or unwanted cells. Angiogenesis. Inhibition. By disrupting blood vessel formation within tumors, fenbendazole deprives cancer cells of the oxygen and nutrients required for growth. This anti-angiogenic effect further limits the tumor's ability to expand and metastasize. Although large-scale clinical trials are lacking, several notable case reports highlight fenbendazole's potential as an anti-cancer agent. These reports provide valuable insights into the drug's effects in real-world settings, offering hope and direction for future research. Stage 4 small cell lung cancer, Joe Tippens case. Diagnosed with advanced small cell lung cancer, Joe Tippens began using fenbendazole, 222 milligrams 3 days a week, alongside conventional therapy and supplements like vitamin E, curcumin, and CBD oil. His unconventional approach drew significant attention and sparked debates within the medical community. After a few months, his scans reportedly showed no evidence of active disease, and he has remained cancer-free for several years. This remarkable outcome has inspired many to consider fenbendazole as a potential adjunct to traditional cancer treatments. Stage 4 renal cell carcinoma. A 63-year-old male with metastatic renal cell carcinoma, unresponsive to multiple lines of therapy, experienced near-complete remission after adding fenbendazole to his regimen, 1 gram, 3 times weekly. His case adds to the growing body of anecdotal evidence supporting the drug's potential efficacy. Serial imaging over 10 months confirmed no signs of recurrence or metastases. This sustained remission highlights the need for further investigation into fenbendazole's long-term effects and potential benefits for other cancer types. Metastatic breast cancer. An 83-year-old female with widespread metastatic breast cancer declined chemotherapy and began self-administering fenbendazole. Her decision to forego conventional treatment in favor of an experimental approach underscores the desperation and hope that drive many patients to explore alternative therapies. Over several months, significant reductions in tumor markers and imaging improvements were observed. These positive changes suggest that fenbendazole may offer a viable option for patients seeking less aggressive treatment alternatives. Stage 3, triple-negative breast cancer. A 41-year-old female achieved complete remission from triple-negative breast cancer after including fenbendazole in her treatment without conventional chemotherapy or radiation. Her case is particularly noteworthy given the aggressive nature of triple-negative breast cancer and the limited treatment options available. Preclinical research supports fenbendazole's anti-cancer potential. These studies provide a scientific basis for the anecdotal reports, offering insights into the drug's mechanisms and effects on various cancer types. Lung cancer models. In 2018, a study published in Scientific Reports showed that fenbendazole inhibited tumor growth in non-small cell lung cancer xenograft models. This research highlights the drug's potential to target lung cancer, one of the most common and deadly forms of cancer. The drug also enhanced the effects of radiation therapy, suggesting a synergistic role in combination treatments. This finding opens up new possibilities for integrating fenbendazole into existing cancer treatment protocols. Colorectal cancer. Research in Frontiers in Pharmacology demonstrated that fenbendazole disrupted colorectal cancer cell proliferation by destabilizing microtubules and interfering with glucose metabolism. These dual actions make it a promising candidate for targeting colorectal cancer, a major cause of cancer-related deaths worldwide. Glioblastoma preliminary findings suggest that fenbendazole may cross the blood-brain barrier, offering potential benefits for treating brain tumors. This ability to penetrate the brain's protective barrier is crucial for developing effective treatments for glioblastoma, a highly aggressive and difficult-to-treat brain cancer. Though large-scale randomized clinical trials are not yet available, early exploratory studies and retrospective analyses have shown promising results. These initial findings provide a foundation for future research and highlight the need for more comprehensive studies. Exploratory clinical trial, 2022. Conducted at a European Oncology Center. This pilot study examined fenbendazole's use in combination with chemotherapy for colorectal cancer. The study aimed to evaluate the drug's safety and efficacy in a controlled clinical setting. Initial results indicated improved tumor control in some chemo-resistant patients. These encouraging outcomes suggest that fenbendazole may enhance the effectiveness of conventional treatments, particularly in cases where standard therapies have failed. Retrospective observations, 2021. A small analysis of 15 cancer patients self-administering fenbendazole alongside standard treatments revealed disease stabilization in some cases. While these observations are preliminary, they provide valuable insights into the drug's potential benefits and limitations. However, confounding factors such as concurrent use of supplements limit definitive conclusions. The variability in patient regimens and the lack of standardized protocols make it challenging to isolate fenbendazole's effects. Fenbendazole's safety profile in humans remains largely unknown due to the lack of formal studies. This uncertainty underscores the importance of conducting rigorous clinical trials to assess the drug's safety and efficacy in cancer patients. However, anecdotal reports suggest minimal side effects, primarily mild gastrointestinal symptoms like nausea and diarrhea. These reports provide some reassurance, but are not a substitute for comprehensive safety evaluations. Key concerns include potential toxicity. Long-term safety has not been established in humans. The lack of data on prolonged use raises questions about potential adverse effects and the overall risk-benefit profile of fenbendazole in cancer treatment. While fenbendazole is well tolerated in animals, more research is needed to confirm its safety for prolonged use in cancer patients. Animal studies provide a starting point, but human trials are essential to fully understand the drug's impact. Self-medication risks. Many patients self-administer fenbendazole without medical supervision, risking drug interactions or reduced efficacy of standard cancer therapies. This practice highlights the need for medical guidance and oversight to ensure safe and effective use. Fenbendazole represents a promising candidate for drug repurposing in cancer therapy, supported by compelling anecdotal reports and preclinical studies. Its potential to target multiple cancer pathways makes it an attractive option for further investigation. However, its efficacy and safety remain unproven in humans due to the absence of robust clinical trials. The current evidence, while encouraging, is insufficient to draw definitive conclusions about fenbendazole's role in cancer treatment. While early case reports and small studies provide hope, well-designed, large-scale clinical trials are essential to confirm fenbendazole's role in oncology. These trials will help determine the optimal dosing, safety, and efficacy of the drug in various cancer types. Patients should consult their healthcare providers before considering fenbendazole as part of their treatment regimen, as its use outside the veterinary context is still experimental. Medical professionals can provide guidance on the potential risks and benefits, ensuring that patients make informed decisions about their care.